Okay, so we have a patient with a COPD exacerbation. He's having shortness of breath, having a hard time speaking more than 1 or 2 word sentences.
Welcome to River Valley Community College's Respiratory Therapy program, where students are learning and preparing for a career as a respiratory therapist using state-of-the-art equipment and facilities.
Hi, I'm Sheridan, and I'm a senior in the respiratory program at River Valley Community College, and today I wanted to show you our classroom. We'll start at the front of the classroom to give you an overview of the great equipment and facility that we have here. Now let's go get a closer look. Hey, what are you guys doing?
We're just looking through our freshman supplies. I realized that I needed a Venturi mask for one of our labs today. And I also want to make sure we have enough of our oxygen trees because we need a few for them for the lab as well.
Now, Morgan is using a bag valve mask to help get the patient's oxygenation up before we try to intubate an artificial airway. Aaron is going to insert a Mac blade to try to get a view of the vocal cords, which is where we want to aim when we're putting in our ET tube. Today we're using a 7.5 tube that is cuffed. She also has a stylet in it to try to help it hold its shape as we enter the airway. Now that Aaron's entered the airway, she's going to inflate the cuff so that it blocks it off, making sure that air only goes in and out through the tube. Now Morgan is manually bagging with the bag and the end tidal to make sure that we have proper oxygenation and CO2 removal. As we can see, the lungs are breathing evenly, so the tube is placed perfectly. Aaron is going to then attach the tube to the face with an ET tube holder that also has a bite block. This prevents the patient from biting on the tube and blocking off their airway. Now that our patient is intubated, Aaron and Morgan are performing a bronchoscopy, which is a procedure where we examine the bronchi of the lungs. It involves inserting this thin but flexible tube, which is called a bronchoscope, through the vocal cords and into the lungs. It can be used to remove foreign objects or mucus from the airway. Also, it could be a diagnostic tool for lung conditions like pneumonia or lung cancer. Now Morgan is performing an Allen's test to see the blood flow to Aaron's hand before she takes a stab at the practice arm. She's performing an arterial blood gas. This test allows us to measure oxygen, carbon dioxide, and bicarbonate within the blood. This allows us to see how well the lungs are exchanging oxygen and carbon dioxide and how the metabolic system is functioning. A BiPAP is a bilevel positive airway pressure machine. This assists with patients' breathing by adding extra pressure on inspiration and expiration, which helps hold the airway open, helping their oxygenation and ventilation, especially in patients in a COPD exacerbation.
So very good, Taylor. Putting the patient on BiPAP is going to help with the patient's shortness of breath. So getting that established, just remember the patient's not always going to be extremely tolerant of this. However, the patient seems to mold right into this therapy as you start it up. So once you make adjustments to the BiPAP, the patient's oxygen does improve. Saturations come up into the low 90s and his heart rate starts to improve.
Currently, Tandra's finishing up an EKG or an electrocardiogram. This is how we monitor the electrical current going on in the heart. Any arrhythmias shown on the monitor tell us how we need to treat the patient. Zach is working with a patient in respiratory distress. They're getting a breathing treatment to help relieve the constriction in their lungs and open up their airways.
The River Valley Community College Respiratory Therapy program provides a comprehensive educational experience using varied instructional methods and state-of-the-art equipment. For more information, go to rivervalley.edu.
The world needs more RTs. Come join us.
Yeah.